Welcome back. The World Health Organization says the number of people infected with Ebola could exceed 20,000 by November unless more is done to control the outbreak. The New England Journal of Medicine published a report Tuesday by the WHO's Ebola response team, warning that efforts to isolate patients, increase clinical care, safely bury bodies, and engage the community must improve quickly to avoid a sharp increase in cases. Christopher Dye, WHO's Director of Strategy and co-author of the study, says it is important to act now.
One of the key messages that we want to get across is that we are now in the third explosive phase of growth of the epidemic. This is exponential increase with hundreds going into thousands of cases per week. And if we don't stop the epidemic very soon, this is going to turn from a disaster into a catastrophe.
The report comes 6 months after the WHO was first notified of the Ebola outbreak. The virus has infected 5,864 people and killed 2,811. Tuesday's report says that although Ebola has been reported in many parts of Guinea, Liberia, and Sierra Leone, more than 90% of the cases have been in just 14 of 67 total districts in those countries.
If it's not hit really hard now, then it'll be in order of magnitude harder to do that. So that's why you want to do it early. You obviously want to save lives, but you also want to have the capacity to do that hitting hard. And the this as you scale up the cases and you scale up the need for beds, you have to scale up your response. And so the $1 billion is a lot of dollars, but if it's not forthcoming quickly, then it will be an even bigger number to get on top of it.
The WHO said Monday that the outbreak appears to have been stopped in Nigeria and Senegal, with no new cases in Nigeria since September the 8th and none in Senegal since its first and only case was reported on August the 29th. Meanwhile, another 30 to 40 U.S. military personnel are due to arrive in West Africa on Tuesday as part of the U.S. effort to combat Ebola. A spokesman said Monday that about 60 personnel had already arrived. Well, as we've mentioned, the Ebola crisis is one of the major issues that world leaders are addressing at this week's UN General Assembly. However, other health issues are also being examined on the sidelines of the General Assembly. Africa 54 health correspondent Linord Moudou is attending some of those discussions, and she joins us now by phone from the United Nations. Hello, Linord.
Hello, Vincent.
Yes, now, as we just mentioned, that there have been discussions going on actually from since the weekend on other issues, but also Ebola. Tell us what has been said about Ebola and which session was that?
Well, there have been a panel discussion, several of them actually, but I had the opportunity to speak to Bruce Aylward, Assistant Director General for Polio and Emergencies at the World Health Organization. He was very pragmatic as to where we are and what is needed. As we mentioned, almost 3,000 people have died and close to 6,000 people are infected. So what Dr. Aylward said is logistic is needed, as it was mentioned by Margaret, equipment, protective gears, gloves, etc., and that requires more funding. More people are also needed. Countries such as the United Kingdom and the U.S. have committed to build Ebola treatment centers, but what is needed is qualified personnel to run the Ebola treatment centers and also to help on a daily basis at all levels. In addition, the third thing that he mentioned is that it is very, very important to adapt the strategy, and there is a need to change or adapt the strategy that WHO has been doing. He says that Ebola treatment was designed for small areas and limited number of cases, as it has been experienced in the past outbreaks. But so what is being done now is how to get a step change in the ways of isolating people. In Guinea, Liberia, and Sierra Leone, a minority of infected patients are actually in isolated treatment centers, and a majority of them are most likely at home, being cared for by families, or they are moving around, traveling, and the infection rate is most likely to increase.
Okay, Lino, I know that there was also a discussion going on there as regards the early marriages of African girls.
Yes.
What are you hearing?
Yeah. Yes, this has to do with the post-2015 agenda on Sustainable Development Goals, or SDGs. So a new set of 17 goals and 169 targets have been identified to be reached by the year 2030. And Goal 3 specifically on health, it says ensuring healthy lives and promote well-being for all at all ages, which include the reduction to the global maternal mortality ratio. However, Dr. Babatunde Oshotimehin, who is the executive director of UNFPA, says one of the ways to achieve that is really to address early marriages for girls, because in some communities, as you know perhaps, Vincent, girls get married as young as 9 years old, and he says that this leads to devastating consequences for a girl's health, because child brides face higher risk of death in childbirth and are particularly vulnerable to pregnancy-related injuries such as obstetric fistula. In addition, the health of the children suffers very much. So child brides are substantially greater risk of perinatal infant mortality and morbidity, and stillbirth and newborn death are 50% higher in mothers younger than 20 years than in women who give birth. And very quickly, former First Lady of South Africa, Graça Machel, also spoke on this issue, and she says she encourages to address this by engaging communities and local leaders and putting in place policies that can discourage this practice. And perhaps I can give you an example if we have time of a success story. Can I do that? Very quickly?
Very quickly. In
Malawi.
We're done. We have run out of time.
Okay, that will be for next time when I come in the studio. Thank you so much.
Thank you very much,
Sure. All right. Bye-bye.
Well, Africa 54 health correspondent Linord Moudou reporting live from New York. Now be sure to watch Linord's health reports every Tuesday and Thursday right here on Africa 54. Stay